and welcome to another episode of the Healing Lyme Summit. I'm your host, Dr. Mariah Hinchy. Today, we're going to talk about the symptoms of Lyme disease. I think that this is easily one of the top 5 most important talks of this summit because Lyme is a clinical diagnosis. A clinical diagnosis is compiled of findings from a physical exam, along with symptoms that are reported by the patient or their complaints, and any other laboratory finding. So, Lyme disease infects every cell of the body, and therefore it can affect every cell, organ, and organ system in the body. And this leads to a multi systemic presentation of symptoms, and it can be very confusing. So, one of the hallmarks is that these symptoms are often multi systemic and migratory in fashion, and they're going to differ from patient to patient because these are infections that actually like to prey on the weaknesses of the body. So, whether they're previous injury or genetic, you're going to have the infections kind of go there like a magnet. To complicate matters, we have co-infections that cause their own symptoms and actually live synergistically with Lyme disease. So the more infections you have, the worse your symptoms can be. And a lot of these co-infections have their own hallmark or telltale symptoms that can help us to kind of like tease them apart and figure out what's causing what. It's very important to know what co-infections are there because a lot of them are not treated with the same medications or antibiotics that you need to treat Lyme disease. And a lot of times, if you can't treat them all together, there can be a priority or an order in which you would want to approach treatment. So, here to help us navigate through all of this information is osteopathic physician Jody Greenfield. Dr. Greenfield is board certified in internal medicine, and he is a fellow of the American College of Physicians. He's been in practice for over 30 years now, and he focuses on the personalized care of patients with complex illness. Welcome, Dr. Greenfield. Tell our listeners a little bit more about yourself and how you came to specialize in treating complex illnesses.
Yes, hi. Thank you again. As you said before, you gave me a very nice introduction. I'm a board certified internal medicine. I formerly did primary care medicine until I fell ill with Lyme disease myself, actually. I had many unexplained symptoms, and us doctors are not taught it very well. And like a typical patient, I went doctor to doctor to doctor until I finally did a lot of research on my own, figured out what I had. Turns out I did have Lyme disease. I wound up finding a specialist who treated patients with Lyme disease, and luckily I got better. And I wound up working with that doctor in his office. I learned much about it and did a lot of research into it, and now I treat patients with that.
That's awesome. I'm so happy that you found someone that helped you. And not only that, but now this is like what you've dedicated your career to, and you're able to help so many other people.
Yes, yes, and I enjoy doing it. I see many patients with very complex medical problems. Some of them were actually diagnosed with other things because Lyme disease can mimic many other diseases. And they were treated for these other diseases and didn't get well. And turns out we took a more thorough history and did more thorough lab testing. Turns out many of them had Lyme disease and or co-infections, and I end up treating them. Unfortunately, it's usually a very long course, but most of them improve significantly. You just have to stick with the program. It's very important.
Right. And I think you just gave out one of the very telltale symptoms, right, of Lyme disease. One of the hallmarks, right, is that it's has these symptoms and then you take a drug that's supposed to manage it and it doesn't respond at all. So oftentimes having a non-response to a medication is a hallmark sign, right?
Yes, very true. And many patients, they used to call syphilis the great imitator. Now they can call Lyme disease the great imitator. I've had many patients that were told they had MS, fibromyalgia, chronic fatigue syndrome, even Alzheimer's disease, ALS, rheumatoid arthritis, hypothyroidism. Many of these things seem like there's something else, but they were treated for these other problems, and the patients did not improve. So I ended up again doing more thorough history taking, more thorough lab testing, And turns out many of them had these tick-borne diseases, and they wound up treating them, and they improved significantly, or even became many of them can become asymptomatic. So it's very
Right.
interesting, very important to be very thorough with your evaluations.
Absolutely. So, because we have Lyme disease and the symptoms of Lyme disease really mimicking and overlapping with the symptoms of numerous other diseases, how do you differentiate Lyme from other conditions? In putting the testing aside, right? Because we know that testing can be problematic, especially if you're not using a specialty lab. But from a clinical diagnosis, how do you differentiate between Lyme and other conditions?
Well, there's certain things you could see, let's say with Lyme compared to some other things. Let's say if someone has arthritis, usually it's just, let's say it's their wrist joint. They just feel pain in the wrist all the time and that's it. But many times patients with Lyme disease, they can have what we call migratory arthritis. One day they could have pain in their wrist, a few days later in their ankles, a few days later in their elbows. So it can move around. So that's one of the ways of telling Lyme disease compared to, let's say, arthritis. Many patients with Lyme disease also, they can have nerve pain. That also can be migratory, traveling throughout various parts of their body. And also, patients with Lyme disease, many times multiple parts of their body is affected. They can have arthritis, plus palpitations, plus memory loss, plus psychological symptoms. So there can be many symptoms in the Lyme patient. Typically affects patient's whole body in many, many areas. And they wind up going specialist to specialist for each particular part of the body. But they haven't found anyone that really puts everything together and try to figure out possibly have one disease causing these multiple problems in various parts of their body.
Yeah. It's funny. I say that to patients a lot. I'm like, what do you think makes more sense? Just from a common sense standpoint, do you think that you simultaneously have something going on, like a different thing going on with almost every system of your body, or say even four systems of your body? Or do you think that potentially you could have one thing going on that's affecting every system of your body? And a lot of times, patients take a step back and they're like, oh, yeah, that makes sense.
Yes, yes, we find that very true. Yeah, exactly.
Yeah. So how do you what's your approach to diagnosing Lyme disease?
Well, it's very, very important to take a thorough history. Could the patient have been in an environment where they could have got it? Uh, I practice in Florida. Many patients are told from their doctors there's no Lyme disease in Florida. However, I've had a few patients that were veterinary technicians or dog groomers, and they tell me they had dogs from all over the world, basically, and the ticks would crawl off of the animals onto their body. So that's one way they got it. I had a patient that actually got mulch from a home improvement store and was in his home, and he wound up having tick infestation in the home. So, and he got Lyme from that actually. So there's many ways that someone could get it, even though it's technically may not be a lot of Lyme disease in that particular area. There's many ways of someone still getting it. So very important to take a very thorough history. Uh, also do testing for the patients at specialty labs. The regular labs that the commonly used labs many times can miss Lyme disease because they don't check as many, it's called bands. Uh, and there's more thorough testing done from these specialty labs. They look for these labs, like there's a band called Band 31, and this band was used when the Lyme vaccine was manufactured. And most of the commonly used labs don't even test for this. And that band is called the Lyme specific band. So if someone has that, that means they're exposed to Lyme and nothing else. Some of the other bands that the regular labs use test for bands which could be Lyme, could be bacteria, could be other viruses. But if you use a lab that checks for more of these, we call Lyme specific bands, that helps with the diagnosis as well.
Yeah. So what besides the hallmark symptoms, what are the most common symptoms of Lyme disease?
Well, there's many symptoms people can have. Like I said earlier, it can affect the whole body. Many times people get, as I said earlier, this migratory joint pain, get joint swelling. Some of these people have memory loss, reduced concentration. Sometimes they have word reversals. They want to say one word, then the wrong word comes in front of that one. I've had many patients that have stuttering, or just the wrong word comes out. I've had some young patients, even say 19-year-olds with memory loss. Now, 19-year-olds shouldn't have memory loss. If you have an elderly person, that may not be so unusual. But if you have a very young person with memory loss, thinking, concentration problems, joint pains. Uh, they shouldn't be happening in a young person. So it's another clue that someone should be thinking about Lyme disease. Another thing patients with Lyme have, they can have depression or anxiety, but it doesn't respond to the usual medications. I've had many patients that say they went to the psychiatrist, they tried many different medicines, nothing works. So that's another clue to think about Lyme disease. Uh, some of the patients can have light and sound sensitivity. Some patients can have carpal tunnel syndrome. I've had many patients with eye problems, with eye floaters, rapid change in the prescription for their eyeglasses, can affect the ears. These people have ringing in the ears, what we call tinnitus. A big thing many Lyme patients have is very bad fatigue. And it doesn't feel like the usual fatigue from not sleeping enough. They just feel really exhausted and wiped out. And no matter how much sleep they get, they feel like they're still exhausted. So those are some of the more common things I would say that we see with the Lyme patients.
Yeah. And then how would you compare those two symptoms, let's say, of Bartonella?
Ah, very good. Well, many times the symptoms can overlap and it can be difficult to figure out which is which just clinically. However, there are some things you see more commonly with Bartonella patients compared to the patients with Lyme disease. Many patients with Bartonella, their neurologic symptoms are really out of proportion with their other symptoms. They can have much more numbness, pain, twitching. Uh, you see a lot of that with the patients with Bartonella. Sometimes they could have even more light and sound sensitivity. In addition, some patients with Bartonella have an unusual rash. It looks like we call striae or Bartonella tracts, these lines on the skin. So that'd be kind of unusual with compared to other diseases we do see with Bartonella. Bartonella, you could also have a lot of GI symptoms like GI reflux or abdominal pain compared to some other diseases. So we put all these things together that can help differentiate between Bartonella and Lyme disease.
And what about Babesia?
Babesia is another important one that patients can get from a tick bite. Uh, with Babesia, typically patients can have even more severe fatigue than with Lyme disease. But Babesia is a red blood cell parasite. It sucks the oxygen out basically from the red blood cells. So patients can get really fatigued, especially after exercise. Many of these patients with just a small amount of exercise can feel wiped out either that day or the next day. Many patients with babesia also have drenching night sweats. Now, you can get night sweats with Lyme, but they're typically even more severe with babesia. And I mentioned earlier that it's a red blood cell parasite sucking the oxygen out. So many times these patients can feel shortness of breath or something we call air hunger. Even just talking to someone, some of these people just feel like they can't get enough air. I've had a number of patients tell me they have call it non-automatic breathing. They almost feel like they have to force themselves to breathe, get enough air in. So this is some big, I'd call it, you said earlier, hallmark symptoms of babesia compared to some other diseases.
Yeah, and then if you have all 3, the great, 3 Bs, then it's like having all of these symptoms at once, and they're all usually much more severe.
Yes, it can be much more severe, and usually we treat whichever the complex, the more severe symptoms, we end up treating that one first, and however try to overlap with the other diseases as well. But typically, I would wind up treating the patients with the most severe symptoms, try to attack that first, basically.
Yeah. So why do you think it's so hard to diagnose Lyme disease?
Well, unfortunately, the lab testing is not super accurate, as alluded to earlier. Uh, there's many bands which are not many, but there's some bands which are not tested by the typical labs. Uh, there's the typical testing is not very what we call sensitive, which means it doesn't pick up the uh, abnormalities in the blood as easily compared to some of the specialty laboratories. The best test for Lyme is actually if someone actually you see the bullseye rash on somebody. That's actually better than the blood test. However, the bullseye rash is only seen maybe depending on who you read, 20% to 70%. I've read typically they say about 50% of people don't get the rash. And the rash doesn't have to look like a bullseye. It can be oval, it can be solid, it can be spotted. So it doesn't always look like the typical rash in patients with Lyme disease. So there's
Right.
nothing always the same with it. So it makes it very challenging. So
Yeah.
again,
And
I said earlier, you have to take a really good history. I'm sorry.
no, I was just going to say, and I think, you made a very, very good point for the listeners. If you see an EM rash, that is diagnostic of Lyme disease. It does not matter what anything else says. An EM rash is diagnostic of Lyme. So, if you're being told you don't have it because your test is negative, it always goes back to if you are lucky enough to see that rash, that is 100% diagnostic.
Yes, and I just want to make up, not make up, say another point about the rash. I've had many patients also that went to their doctor and a circular rash, and were told they had ringworm. However, they were given treatment for the ringworm. The cream didn't go away, and these patients also had multiple other symptoms as well that they told their doctor about. And the doctor said, don't worry about it; it's ringworm. So again, very important to take everything into account. If you think you're not getting better and something's not right, you should investigate further.
Yeah, absolutely. Go with your gut instinct. It's funny, you're making me think of I had a patient who was on vacation in Florida and she had an EM rash and it was actually like hot red, it was about this big. It was right under her bra and she was having dizziness, she was having headaches, she was having light sensitivity, and the doctor at the walk-in clinic said, well, you obviously have some sort of insect bite, but it's definitely not a tick bite because it's not a bullseye. And she's like, "But, I have all of these symptoms." And he was like, "Well, maybe you're tired from travel." Like, completely dismissed it. And, I mean, it's just, it's one of those things that's so disheartening because it's like, okay, like if the rash isn't there and you get misdiagnosed and whatever, just out of like not being educated, but then it's like here you have the rash, you have the symptoms, you went to the doctor and you're still being told, well, it's anything but Lyme.
Right. Sometimes we would call that NLD, not Lyme disease. So it's important to still investigate further if you think something's not right with your body.
Yeah. Okay. So, how do these symptoms change over time? Like, walk us through kind of like an acute presentation all the way down to, a chronic infection that someone may have had for decades.
Well, it's a very good question. Uh, Typically, the longer it's been in someone, the more symptoms they'll have, and the harder it is to treat. Many times, someone could have a tick bite and have no symptoms. Actually, they could have symptoms days, months, or even years later. So it could take a long time to get symptoms. Many times, people could get symptoms right away. Typically, someone will have we call it flu-like symptoms like fever, chills, headache, stiff neck. So if someone has those, right away, you should go to your doctor right away and have it checked up to see if it is Lyme disease or just flu-like symptoms. Could be the flu. So you should evaluate, try to figure out what it is. But over time, many times these symptoms come and go. Like some people, they'll have symptoms that'll go away, then over time it'll come back again, it'll go away, and come back again. But when it comes back again, typically they get more and more symptoms, more and more intense. Some patients get more and more joint pains over time, more and more brain fog, memory loss, thinking concentration problems, nerve pain, insomnia is a big symptom as well. Some of these patients get more and more insomnia as well. So the symptoms typically get more and more and more and stronger and stronger and stronger over time.
So, as it kind of ravishes more of the systems of the body, you end up with more symptoms in more systems in a more severe state.
Yes, and the longer it's in someone, typically the longer it is for them to get better when they're getting treated. So
Right.
again, if you think something's not right, it's important to address it and try to get it treated as soon as possible.
So, aside from how long the infection's been present for, what else do you think accounts for like the differences in presentation? So, like, I've had patients that have had maybe like two or three symptoms. They're not the majority, but it's happened. And then you have other patients where literally it looks like multi system failure. What do you think is behind that?
Good question. I'd say nobody knows for sure, but there's some possibilities. Some say it could be possibly hormonal. Let's say men versus women. Typically, women are more affected by Lyme compared to men. Typically, have more symptoms or stronger symptoms. Possibly it's genetic. Maybe there's genetic differences in people. Why some patients would have more symptoms compared to other symptoms. Another thing is if someone has certain medical conditions, which weaken your immune system, then you can make somebody have more symptoms and stronger symptoms as well. So those are some things I would say that could cause someone to have more symptoms or some differences, excuse me, symptoms.
Right. So there's different species of Lyme, right? Like we have this group that causes Lyme, and then we have another group that causes like tick-borne relapsing fever, right? So just in those two different categories, can you talk about the little bit of difference in the way traditional Lyme disease versus tick-borne relapsing fever might present in somebody?
They're typically pretty similar, and sometimes that's what one of the things that makes it difficult. Some doctors do check for Lyme disease and it comes back negative. However, the patient can have tick-borne relapsing fever, which can have many overlapping symptoms, and they may not be diagnosed with Lyme disease because they'll not check for that. Because most doctors wind up not checking for that; they're not as educated in it. Uh, However, tick-borne relapsing fever, the word fever is in there, so those patients can have fever compared to the patients with traditional Borrelia or Lyme disease. Sometimes every few days they'll have a temperature spike. So that's one of the ways to tell difference potentially tick-borne relapsing fever compared to, say, regular Lyme disease.
Yeah. And are there any hallmark symptoms that you know based on the different species? And would it matter when you're treating somebody for Lyme, whether, if it's Borrelia is Borrelia, right? Like, does it matter?
Yeah, I haven't seen a difference actually in terms of symptoms or treatment. Uh, they used to say some strains are more from America, some are from Europe. However, there's so much traveling that's going on. There's species all over the world now. And typically, whatever species is, it seems like the symptoms can overlap and be very similar, and treatment's pretty much the same. So I'd say typically not much difference, actually, from what I've seen.
Okay. Well, Dr. Greenfield, I want to give you the opportunity to let our listeners know where and how they can find you. And if you have any exciting events coming up that you'd like to share.
Okay, I'm in Florida, and right now I'm doing consults via telemedicine. My website for my office is getwellmedicalcare.com. And I try having some useful information on Instagram. And the handle is the letter J, and my last name Greenfield DO. So J Greenfield DO on Instagram. Also on Facebook, Get Well Medical Care South Florida. I recently done some presentations at some medical conferences, but nothing coming up yet, but there probably will be in the future.
Wonderful. So, if you are a Summit purchaser, stay here because we're going to dive deeper into this talk about Lyme disease and clinical diagnosis. And if you're not, click that button down there so you can come along with us. Okay, so let's jump back in. Um, how does tracking of symptoms aid in both your treatment, but also knowing like when you're pretty close to having this infection resolved?
Well, that's a really great question, actually. Before my first visit, I have patients fill out a very long questionnaire of potential Lyme symptoms. Do you have it mild, moderate, or severe? Is it frequent or infrequent, etc.? And that's prior to the first visit. And then obviously we have first visit, we talk about it. And each visit, when the patients come back, I compare their symptoms at their follow-up visit compared to their prior visit, as well as compared to their initial visit. Many times patients will come back for their follow-up visit and say, Doc, no change. However, when I go through each of the questions, oh, that's better. Oh, that's better too. So it's very important to use these symptom trackers to see if there's any change in symptoms. And hopefully the goal is to have whatever they came in with and not having those symptoms anymore after the treatment.
Yeah, I find it so helpful. I can't tell you how many times I've had a patient come in and say, I'm not feeling any better. And then, like you said, you go through their symptoms and they're like, oh my God, I forgot I was even having that. It's like, yeah, So um I think that seeing the symptoms unraveling and improving in their severity and frequency makes such a huge difference. You have patients come in who are on anti-inflammatories or NSAIDs, right? And they're taking them almost every single day, and their pain level is still, a 10 out of 10. And then it's like, okay, they are like, well, my pain's down to like a 7 or an 8, but I'm no longer taking Advil every day. And so it's like we have to look at all of these other things. It's like, wow, not only did you have a reduction, but you aren't taking, something to control it, which you had been taken for months, if not years. Um, and it's funny because if a patient's having a bad day, nothing's better. Things are often, worse is what they'll
Right.
just generally tell you. And if they're having a good day, then it's like, oh, I feel good, So I think having, even though it's subjective because they're reporting how they're feeling over time, when you have those side by side comparisons, like you're speaking of, now that actually becomes like objective information that you can compare and use to justify your treatment and prove that it's actually working. So, I think that tracking is so important.
Yeah, especially because there's no great test for Lyme disease to see if it's gone away or better. So
Right.
that's, I'd say, the most important thing to check to see if somebody's getting better. Or if they're not getting better for some reason, then you have to reevaluate. Do you need to change the treatment? And this is a way of telling should you be changing the treatment or not.
Yep. You just made me think of a funny point too. So I've had Lyme patients where they've retested, they just want to retest, they want to do the test again. And, most of these tests that we're using are indirect tests. So they're measuring the immune system's response. And I've had patients come back and be like, you've made my Lyme disease worse. I'm like, what? Why? How? You said you were feeling better. Well, I am feeling better, but my antibody levels on my IGeneX test, I only had like an IND before, and now I have two pluses. And it's like, we've enhanced your immune response, which is a good thing. It doesn't mean like your load of infection got bigger. So, to your point, there's really no testing that you can do, to show that the infection is resolving. I mean, other than looking at like CRP, which is an inflammatory marker, or high sensitivity CRP, or some of these immune markers, if we've been tracking those, they can show an improvement. But yeah, it's mostly clinical picture, right?
Yes, and like you said as well, the Lyme bacteria can suppress the immune system. So some patients will look like they don't have any Lyme antibodies, a very few, and they said the previous doctor said that they don't have it because they don't have antibodies. However, they may not be educated enough in that, the Lyme bacteria can suppress the immune system. And as you said, after patients were treated a few months, their immune system is not suppressed. So all of a sudden, they're making all these antibodies, which they would have had, but now they've not suppressed their immune system. So now they can show that they have these antibodies.
Right. So, what do you think are the most important things for the listeners to know about Lyme disease from a diagnosis standpoint?
I'd say the most important things, I would say very important if they have the bullseye rash or a circular rash, especially if they were camping and if they had flu symptoms as well with that. They sounds like they most likely have Lyme disease and they should seek out a healthcare practitioner that's willing to treat them for that and or at least evaluate that as a possibility. So I'd say that's one of the most important things. And I would say another important thing is if someone has sudden onset psychiatric symptoms as an adult with no obvious reason. Nothing bad happened in their life. And they tried many different, with their doctor, many different medications for the psychiatric symptoms. And none of them gave a good response. Another thing to look at is Lyme disease for sure. And I'd say the most important thing is to know your body and don't give up, especially if you have symptoms in many different parts of the body, joint pains, palpitations, severe fatigue, night sweats, memory loss. You have many symptoms, many parts of the body. Don't give up. Make sure you seek out someone that can help you out and try to get better.
Absolutely. And I think, going to ilads.org, ILADS.org, they have a wealth of information. They can help you to find a Lyme literate practitioner in your area. And, I think one of the most important things is to get with a physician that knows what they're doing, that is Lyme literate and knows how to diagnose and treat.
Yes, and occasionally ILADS will have some webinars for patients as well. And as you said, they have a section on there where you could seek out a Lyme literate doctor in your area to try to find someone to address your concerns.
Yeah. So, anything else you would like to share with our listeners before we conclude our interview?
All right, thank everybody for listening. The most important thing is, it's again, know your body and get checked up if something is not right. And again, I see patients in Florida at getwellmedicalcare.com. And the office phone, if you're interested, is 561-413-2869. And I thank everybody for listening.
Thank you, Dr. Greenfield. And thank you all for joining us. I hope that this information was helpful and helps you on your journey to healing Lyme disease. Take care.